Coming up next on Insights on PBS Hawaii, what is standing between Hawaii veterans and full use of their benefits and services? Aloha and welcome to Insights on PBS Hawaii. I'm Malia Maddock. Numerous benefits and services are available to military veterans when they leave active duty, such as healthcare, housing, and employment assistance, and in some cases, pensions and disability compensation. For many veterans, this assistance is critical for a productive civilian life. But not all are able to find the help they need. What is standing between Hawaii veterans and full use of their benefits and services? We want to hear from you during tonight's conversation. Call 973-1000 if you live on Oahu, or 800-238-4847 if you're calling from a neighbor island. You can also watch Insights streamed live at pbshawaii.org. Just click on the title of tonight's show. You can find us on Twitter, too, at PBS Hawaii. Now to our panel. Thomas Frattinardo is a retired U.S. Marine who served in the Gulf War from 1990 to 1991. Since leaving active duty, Mr. Frattinardo has been an advocate for veterans' rights. Daryl Vincent is the Chief Operating Officer for U.S. Vets, an initiative that provides long-term supportive housing for veterans, as well as a work reentry program called Veterans in Progress. Andy Dahlberg is the manager for homeless programs in the VA's Pacific Island healthcare system. He has worked with homeless veterans in different capacities within the VA for the past 25 years and has presided over a homeless ministry at St. Andrew's Cathedral for the past 12 years. Dennis Egi served in the U.S. Navy for 20 years, retiring as a Chief Petty Officer. Since 2006, he has been president of the Hawaii chapter of the National Association for Uniformed Services, an organization that calls itself the Service Members Watchdog on Capitol Hill. Welcome, gentlemen. Thank you for joining us. Mr. Frattinardo, let's start with you. You've experienced this on a personal level. A year ago, Hawaii was being singled out as, some said, offering some of the worst veteran services in the country. In your experience, have things improved since?
There's still a wait time for veterans. It's not intentional. It's not malicious at all. It's a fact that the staffing needs in Hilo and Kona for the Big Island.
And you're in Hilo?
In Hilo, correct. They're just overwhelmed. They're overwhelmed administratively, and they're overwhelmed with the amount of veterans that are having to see the physicians and nurses there at that staff.
Have there been improvements?
There have been improvements as far as they've got My eVet, so you're able to get in touch with your primary care physician, but to back it up quickly, it's being able to get into the door and get the actual treatment. So you have to go, the first door you have to walk into is the VBA. So it's silos. You have VBA and VHA, which is Veterans Benefits Administration, and then Veterans Health Administration. So until you can get approved through VBA to get those benefits, the door is basically shut in your face.
So that sort of structural problem, if you were continuing to see, causing problems. Mr. Vincent, are you seeing that in terms of the veterans that you try to help?
Well, we're working with mostly predominantly homeless veterans, and we're starting from the ground floor, making sure we're trying to get into housing, treating substance abuse, mental health, and we have direct access with the VA to get in that program, working with Andy and his team. And then after that, we facilitated through the VA. So I can say that I understand and I've heard those problems. But for the most part, our focus is getting them back to work, making sure they get the benefits they're entitled to, and also making sure they're getting the treatment they need. So we've seen a little bit of improvement in that as well.
What improvement have you seen this year?
Well, a lot of veterans are coming into the program, and we have more programs now. The VA is offering 2 different programs. First, it was just a per diem program. A homeless veteran comes in and we help them get themselves together and get back to work. Now they have the Supportive Services Veterans Families Program that allows us to help a veteran that's in his home with prevention before they become homeless. We'll allow them to give them their first month's rent, give them case management. We'll allow to rapid rehouse them is what we call them. If somebody is homeless, you want to get them back into housing as soon as possible. So the improvements I've seen in the benefits overall for homeless veterans has increased as we strive to get to 0 by the end of 2015.
Let's go ahead and talk about homeless veterans. Mr. Dahlberg, in terms of what the VA is trying to accomplish, do you have any sort of projected timeline for trying to solve this problem locally?
Well, our goal is to end homelessness amongst veterans by the end of this year. But I'd like to kind of pick on something that Tom said. I started in the VA 25 years ago in New Jersey. And at that time, I was working at an Episcopal church and as a youth director, and I needed to do something to make money. And I got a job in the VA in their homeless program there. And the thing that amazed me was, and this was just when the homeless programs were starting up, was the innovation that was taking place. And something connected in me at that time, and I saw compassion and passion in the people that worked in that department. And it pains me to hear that, you know, other people's experiences at the VA were not like that, but I found that in the homeless programs, innovation has been the hallmark of what goes on. And to pick up on something that Darryl has said, the homeless program has rolled out almost program after program and gotten all kinds of funding to help us, give us the tools to end homelessness. And I think that's best reflected in the staff numbers that I have. When I first came to this program in 2010, there was 5 staff. There's now 54.
So you're seeing, Mr. Egge, you deal with this on a national level in Washington, D.C. Are you seeing this innovation that he's talking about on a national level and new programs and some movement?
Well, we serve as the eyes and ears on the ground, the boots on the ground here in Hawaii. And when asked, and sometimes without being asked, we advise our upline in Washington, D.C., this is what's happening in Hawaii. If you see something similar, we're just adding to it. But I see myself, by being a delegate on the Oahu Veterans Council, I hear about the programs, Darryl's programs, and I haven't heard from Andy, but he has attended our meetings, and it's nice to hear Tom say that there is improvement there. They're increasing the infrastructure available, and it needs more. I think more people need to pour out of the silos and out into the field. There's a huge resource there, and one of the problems that the veterans do see is they bring their VHA problem to a VBA person. Oh, we don't deal with that. And for the longest time, we had a VBA person. And I said, why don't you have a VHA/BA person that kind of is a gatekeeper? You go here, you go there, rather than let the veteran explain a situation almost as a victim. And I cannot see a military person being a victim. A casualty, yes, but not a victim. And we're all casualties.
What services are we talking about? I mean, when you went in for services, what were you looking for?
I had broken my back and my neck in the Marine Corps. So in order to get treatment through the VA, you just can't walk into a medical clinic and say, please treat me, I broke my back. You have to be able to prove that it occurred while you were on active duty in the Marine Corps. So you have to make that a service-connected claim. So normally when the paperwork does go through, they review it. If you do have statements which can prove your injury, like old medical records, like I've made copies of my medical records when I discharge, and I recommend any veteran that gets out who's been injured, make copies of your medical records. They'll establish that injury or wound as a 0% injury. So that's just to get your foot in the door so you can go from the Big Island up to Honolulu to Tripler to have a compensation and pension exam.
And did you find that things stood in your way of getting the care that you needed?
For us in the Big Island, it's distance. It's 216 miles from Hilo to Honolulu. And at that time in 1995, the CBOCs, the community outpatient clinics, were much smaller at the time with a much smaller staff. And it was just harder because they had smaller staff in Honolulu at VBA. So we're still dealing with those problems today, but it's getting better.
So how do you think a veteran's experience now would be different from the experience that you had, or would it be different?
Well, speaking with veterans, I have a couple of next door neighbors that are Vietnam veterans, and there's 2 types of claims you can have. You can have a regular claim or a fully developed claim. So for this one particular veteran, he had a fully developed claim. He had prostate cancer. So through his oncologist, his primary care physician in the civilian world, he was able to establish that this occurred in Vietnam because he was exposed to Agent Orange. So it's presumed with Vietnam veterans, if you're in country, that Agent Orange can cause prostate cancer. So it's been 18 months, and a fully developed claim is supposed to take 90 days. So 18 months ago, he made this fully developed claim, and he's still bouncing back and forth with VBA, and he's still not being treated.
Between the two sides that you were
Correct.
describing.
And he still can't get treatment.
So is there any discussion at the VAs about this problem between the two sides? And I know that the services isn't your specific area, but do you hear conversation about this being a continual problem?
Yes, and we're in a world now in the VA where everything is measured and has some kind of a timeline to it. And I can tell you that within the last 4 years, we've had just more and more performance measures and more emphasis on outcome. I'm mostly a mental health person, so but I understand the dilemma from VBA.
It seems from an outside perspective that having this separation seems to be a main source of complaint. I mean, would you like to see that separation, or in your experience, would it be good to just have that wall come down and have a unified entity?
They don't communicate with each other.
Is this your experience as well, Mr. Vincent?
Well, I would say that one of the things that we always have to look at when you're trying to access services, whether it be the VA, Social Security Administration, any kind of state or federal regulation that's doing that, one of the things that the VA and our programs that is implemented is what we call peer mentors. Once you get inside there, obviously I don't have the knowledge of what's the things that take place, as he's pointing out. But in terms of just getting in the system and knowing where to go access care and doing things, we're learning how to hire other veterans that have done this already and can walk them through.
And
say
know
this
how
way.
to.
At least know what the questions to ask, where to go, and how to do it. But once it gets to a certain level, obviously it's still going to take some personnel in the VA. But we've seen that to be very effective, to have other veterans lead veterans through this process of whatever it may be, to get whatever access to care they need at the VA.
And that's a model that we've followed as well with peer specialists. And we have intentionally brought peer specialists into our program to help veterans with those kinds of issues and to address issues that bookish people that have not dealt with those issues don't know.
Mr. Aggie?
I'll pass this to you. About a year ago, one of our congressional representatives for our congressional delegation held field hearings at the Oahu Veterans Council, and there were about 6 or 7 people that were selected to be on a panel asking that person questions and answering questions. And the issue seemed to be identification. They all said, we need ID, we need ID. Well, during the break, I presented that to
Your VA card.
and I said, that's the ID that we're talking about. And they were astounded and showed the card to a staffer, and he said, yes, that's the card. So every enrolled veteran has an ID card, and one member of our congressional delegation introduced a bill that would empty the silos, at least the health benefit silo, by outsourcing the delivery of health care to our medical industry, healthcare industry in the United States. It would leave the VA in the VHA silo with enrolling new members, determining that they did qualify to be an enrollee, and investigating any irregularities that came to their attention, and problem solved. Because everybody who's working in the silo is doing a job, and they would suddenly find themselves out of work in VHA, but they'd be crying for them in the healthcare industry.
And that's a problem, from my experience, trying to find someone to do a knee surgery or trying to find another physician for another problem I may have had. It's finding the physician that will accept VA payment. So the challenge is how can we incentivize VA payment to encourage those physicians now that don't accept VA payment, like on the outer islands, the rural areas where we don't have a lot of that medical care, or where the staff at VA is so overwhelmed that they can't see you right away. So they had the choice program that just was enacted back in November. So if you're eligible to be in the choice program, you have to be in a rural setting. So with the choice program, you have, once you are eligible, you see a doctor. You have to get approval within 7 days, but only if you can find a doctor that will accept veterans' payment. And it's a struggle.
So let me see if I understand. This program, and it widens the circle of physicians that you might be able to see.
They took $15 billion to go nationwide for the choice program, and that's so a veteran, if they can't see it, that's already service connected. If they can't see their doctor at the CBOC, they can find a doctor in the community. But that's the challenge for like the Big Island. We don't have that many doctors that will accept VA. So how do we incentivize that to get doctors motivated to accept the payment?
So would you say that among the services or benefits provided, that medical service is the single hardest thing to get? Is that the biggest block?
And for a lot of the older veterans, Korean War, World War II, Vietnam veterans.
That would be it.
Single most important.
The most important.
And at the time of the hearings, I suggested that VA enrollment card become proof of insurance.
The card.
The card itself. And the precedent's been set. It's called Medicare. My Medicare card is proof of insurance.
And so make that basically like a
and the
Medicare
VA
card.
would pay, and the doctor would have the same incentive to treat us as they have to treat a Medicare patient.
So is that an active conversation in Washington, D.C., doing something like that? Not yet, from your expression.
No, it's not. That I know of. It's not. But I do know that the bill was introduced and and instead Congress decided that they would send another $10 billion over to the two silos.
Over the past year, the administrator for Veterans Health now, it went from solely through the managed care office in Tripler. Now it's gone to Tri-West. So now you've added an outside organization that's being hired by the VA, which is actually taking longer for instance, I had to get an MRI. It took me nearly 2 months to get the MRI for my knee. Or if I had gone to a private physician, he could have ordered it up and I could have maybe saw an MRI clinic like in 2 weeks. So it's just that much longer
That wait.
to get the wait.
Mr. Dahlberg, let me give you our first question. Maybe you can give us the other side of this. Should we reduce the number of responsibilities handled by the VA, privatize them? Any thought on that?
Wow, that's a good question. I don't know. I'm involved so much in the homeless world with VA. I've never really thought of that, but I can tell you that we are trying to work with other organizations and the private sector as much as we can, because in our homeless discussion, homelessness is not something that one agency can solve. It's something that all the fabric and groups of society need to solve. And we actually reached out in November and started a homeless veteran task force and included, which is chaired by John Henry Felix, and includes members of the business community, retired flag officers, and the clergy. They need to be involved as well. So yes to privatization, we're trying to include them.
Here's a question that along the same lines from Doug in Hilo, a former Army captain. He thinks the VA has enough doctors and staff. The problem is the doctors are not motivated. The VA services should be privatized. Mr. Vincent, any thoughts on that?
I would agree.
You would agree? Would you agree?
I would agree that there are certain services that are better to privatize. We've seen it as Andy, I work hand in hand with the homeless services. That's one thing that's been contracted out. VA is not going to do homeless transitional housing. So for years, they've done per diem programs, contracting with nonprofits, giving the oversight, giving the clinical oversight, paying the per diem, and working side by side with the VA, that we provide one service and we collaborate with each other. Obviously not all of the services. There's some things that can be better handled at the VA comprehensively. But if it makes sense, because due to capacity, due to other issues, to be able to contract that out, it is proven that a relationship between the VA and the nonprofit and the community agencies has proven to be quite effective.
Let me then ask a follow-up question. Which services would you privatize? in full or in part, and which would you leave entirely with the VA?
Well, I will defer the answer about the medical part to our colleagues up here, because I don't experience that as much in our programs. And the reason why is because once they get into our program, our veteran automatically gets access to the VA. They're in the homeless program. Now we can work directly with the homeless clinician, who can then make the referrals to the doctors and get things done. So they're in the system, they're in a program, so we don't experience a delay as much as maybe people that are not inside those programs. So I speak more from the social service side of the house of case management, mental health, substance abuse, housing. We would like to see that contracted out.
Okay, and could you identify any other than housing that you would like to see privatized?
I would say probably the only thing I can say is, like I said, case management, social work, some of those things. We can collaborate. The VA has a HUD-VASH program that's very successful. It's permanent housing. Some of those services that need to be augmented with the case management, with peer specialists and or housing specialists, those type of things. It'd be great to collaborate because it's been proven to work in the per diem program. It's working now. Just saying that probably a collaboration of doing that would be effective as well.
Could expedite.
Great question, and I just want to reframe that a little. It's been a long day, but we have privatized with, Darryl says, with our grant per diem program, also with supportive services for veterans and families for like $5 million.
So it's happening.
So we have, we have done that. I think we've taken the lead in that.
It's been effective.
Yes.
We've just heard, and incidentally, every veteran who is enrolled has received a choice card in Hawaii because we have no VA hospital here. So we qualify de facto for a choice card. But going to U.S. Vets, thanks to them, I believe that a veteran can shed his victim's persona once he's into U.S. Vet, and he reverts back to becoming a casualty again because he's going to be treated and he's going to be rehabilitated, and the terminal objective is to return him to society with his new peers that were his former peers before he became a veteran.
We have a question actually about the choice card. I was wondering if any vets have used the new Veterans Choice Card Care Program and what troubles they've had with it. Have there been troubles with the choice card program?
I haven't had any.
I haven't used it. Although I'm eligible to use it, I haven't used it.
Okay, and you've had no
I
problems with it?
haven't used it.
Yeah, you haven't used it.
So for me, it was unnecessary. I waited the 18 months to have my tinnitus rated, and so that got me into the system.
The rule for the card is you have to call in and get the approval. This is a doctor I want to see. This doctor accepts VA benefits or VA payment, but then you have to wait. So if it's a routine health matter, you have to wait for the approval. And I don't get that. Why should a veteran have to wait? If you already have the card, see the doctor is already going to accept payment, and they can just bill the VA.
So that would be the problem.
So why do we have this 7-day waiting period when a veteran shouldn't have to wait?
And that's something that I would imagine has to be smoothed out on a federal level.
Well, we have the choice card. The doctor accepted the terms of endearment issued by the VA, and the doctor proceeds, having received the fax or something from the VA to the effect that you are now allowed to treat this patient who we see is enrolled in our system, and he gets paid.
But there's physicians on the Big Island that, regardless of that card, they will take veterans automatically.
They will.
And they'll treat veterans without, only because they appreciate what the veterans
That
have
has
done.
to be a godsend in a rural community.
It is.
Yeah,
it is.
absolutely.
In emergency cases, they'll do that.
That might lead to our next question. Is there a connection between healthcare wait times and homelessness? Have you seen instances in which that wait, that lingering health problem has then led to homelessness?
Yeah, well, we can say that obviously anyone that's homeless is going to have conditions that become exacerbated from being homeless. Health, mental health, substance abuse. Again, for the ones that we're reaching out in the community, yes, health conditions that can normally be treated on a regulatory basis become emergencies. Things as diabetes, high blood pressure, things that could be handled usually if you're going to the doctor. What we can say is that once they're enrolled in our program, we have direct access for that now. Now we have the VA that's working on site with us, and we're able to take them to the VA, and they start getting those care. But then the homeless program becomes the conduit to the rest of the VA facility for mental health, physical health, and those type of things. But yes, it's one of the things that is very high priority when we get veterans in the program is their health. and because a lot of health conditions go unused, and then it becomes a burden on the society. When I say a burden, things that could be treated normally now are becoming emergency and ER visits versus just going to see your regular doctor.
And it gets more and more expensive and harder to deal with.
Absolutely.
And in response to that great question, we have a homeless patient line care team on the leeward side, where we actually have a psychologist and social worker that go out and provide outreach, mental health stuff right there on the spot. And then with our HUD-VASH program, we have we could call it a medical team of 2 nurses and an occupational therapist that work with the most chronic of our homeless veterans. So we're trying to deal with that very, very question.
We have about currently 700 homeless veterans in Hawaii, is that correct? About 2/3 on Oahu and 1/3 on the other islands?
From the last point in time count, that's right.
And is that number increasing, decreasing, any sense of which direction it's moving?
Should I go first?
Sure.
What is unique about where we are now is we have kind of developed a system for the first time where we have statistics. And we've been working, and this has been part of we were part of the 25 Cities initiative, one of the 25 cities across the country where homelessness was actually increasing. And again, this is a national problem, and it requires kind of a national effort and focus. And we work with an agency called Community Solutions. We established a monthly takedown target of 57 placements per month.
And that means that you will try within that month to have 53 of those homeless veterans transition into housing, is that correct?
57 homeless people placed. And since we started in January, we've housed over 400. And that's the kind of world we're in now. So we believe the needle is moving. But at the same time, there are also new people that are falling into homelessness. So it's hard to give an actually precise number.
Well, there's a couple of things that I think attribute, especially for Hawaii. U.S. Vets is the largest nonprofit homeless service provider, so we have 11 locations. So I get the unique opportunity to see the different locations that are solving homelessness in the home. And obviously, Hawaii, affordable housing is a big issue. Hawaii, to be one of the smallest states, if not the smallest, has every single branch of service stationed there. So we have every base here. So a lot of people are getting out of the military here as well. So we understand you put together poverty and lack of affordable housing and lack of being employed or underemployed.
And possibly far from family.
Absolutely. And then you can see how someone can fall into homelessness. So I like to attribute those numbers, especially since the great work we feel that's being done with homelessness, of why we see it going up, is the military is downsizing right now. We have a lot of people getting out. We have a lot of people that are coming out and not being able to afford the cost of living, but yet wanting to stay here because they've established roots here. And I would like to say that attributes to it. And we want to say that we have to solve that, because I go to other communities, Vegas, Arizona, Prescott, and our different communities, and they're experiencing a decrease.
Right.
I go to our other communities, LA, DC, Hawaii, they're experiencing stagnation or increase, and these are high cost of living areas. So I think there's a correlation between those two.
So even if the programs are getting better, it's hard to catch up to the issue, in essence.
Have to catch up to the issue, have to do more prevention, have to do more collaboration with DOD when veterans are getting out of the military and catching it then.
Do you have any sense of that number, roughly, what percentage might be dealing with post-traumatic stress or any sort of mental illness in addition to the other issues that you mentioned already?
Well, we can say coming in our program, out of every 10 veterans that come in, anywhere between 50 to 70%, it fluctuates, will have a substance abuse and or mental health problem. Between 50 to 70%. And now out of those ones, once we get it under control, or they get under control, they can go back to work. It's not someone that's going to be permanently disabled. Out of those, about 30% are permanently disabled. You know, they're never going back to work, and it's our job to make sure that we get them to the highest possible point they can to live independently. So yes, and we're not saying that that's the problem that prevents people from being home. There are far more people with mental health and substance abuse living in homes than living in the street. So that's not the problem. They become exasperated when you're living in the street. What it is that we have to address it. We have to address it, so we put them in the home, permanent housing, HUD-VASH program, U.S. Vet Social Services, wrap the services around them in their homes, and we can tackle this problem. It's been proven that it can be tackled.
And here I think is also another way of showing how key the VA is, because we understand the military culture. We understand the importance of PTSD. We have great programs, we have great doctors. And we're fortunate to work with great partners like U.S. Vets to help put as many arms around the problem as we can to solve it.
Did you want to add something?
They're doing great work with the homelessness. But when you have a veteran that's not homeless, that needs health care, that owns his own house, that may be retired, when they go through the VBA, the frustrating process of having to collect all of this evidence, what we need for these people are, like when the Affordable Care Act was developed, they need navigators who work from the VA to help navigate these people through the system. I developed my own claim. I started in 1995, and the claim is on, it's 38 Code of Federal Regulation. That's what governs the VA claims process. So you've got to learn, you've got to teach yourself on how to make the claim. A veteran has to realize, this is my own personal responsibility. If I'm going to make the claim, I have to be able to do it myself. And there might be people that can't do it. So for those people, let's get them a navigator through the VA. Just not a 1-800 number. There is the DAV process, the VFW, but President Obama in his 2016 budget, one of the elements of the budget is he wants to make it people-centric. So put a face on the veteran. So also we want to see who's actually processing the claim. So that face-to-face element puts that human element behind it. And I think it makes it more of an urgency to get that claim through the process.
Instead of feeling like you're in a system where no one really understands or knows who you are.
Correct, yeah.
All right.
The
Sorry,
funny
go
part
ahead.
about the homeless situation is the same issue happened, and we learned how to tackle it. So I agree with him totally. Is that for us to say there's this many homeless without identifying the name and who they are, and then putting them through a coordinated intake, which we're doing for all homeless now. If someone gets identified homeless, they go to a place and say, "Here's all the services. Where are you best served?" Well, it doesn't take scientists to figure out. That may work in this situation as well. Where are these people? Who are they? And exactly as he said, the navigators to enter the system and have a coordinated way of doing it with somebody helping them guide them. And so you could use the same mentality.
And that's back to your point, which is ironically, and some of the more desperate vets are perhaps getting better access and the care that is needed, or the innovation that's needed, and it would be good to see that same innovation come to vets who might have a home or be somewhere stable but need the help.
Well, it's an intimidating process because the application process for like a veteran who owns a house, who's retired, who has some type of income, the questions on that application say he wasn't, because retired people who are veterans can apply for veterans benefits. So some of the questions are, do you own real property? What is your income? So when they start reading that, they feel intimidated that, you know what, these guys are going to take that away from me. And they don't know because they haven't applied for it, but yet they don't want to, they don't trust the government to do that.
So it's almost also a question of, should that questionnaire be changed to be something a little less intrusive, at least at the beginning?
No one asked that question of me when I went off to go fight in battle.
No. And the questionnaire should be eliminated. You should be assigned to a caseworker, and that will be your advocate within the VA. And it reminds me of my wife's experience when she retired from her public sector job in California. It wasn't military or veteran related. The advocate with the facility she worked at showed her all the options that ended up giving her the best possible benefit she could get in retirement. She didn't have to ask any questions. And if there's any documents that needed to be proved, then the advocate finds them for you. They have the access. And it allows the veteran to shed their victim's persona. When the veterans start acting like victims, it's just out of character for them.
And hard emotionally.
I just wanted to mention something too. The continuum of care, the homeless continuum of care that Darryl and I are part of, we are functioning as a system now, but it's taken us a long time to get to that point. It's taken us a long time to learn that this is a team sport. That's how we're going to solve homelessness, by being a team sport. And it sounds like you guys are talking about the same kind of thing.
Right. Well, I've always maintained that a veteran remains for as long as he lives in the charge of the VA. All the veterans in this country are in the charge of the VA, just as your unit commander, you were in his charge when you were serving on military, You left, and then, okay, do I become a victim now to get any attention? It usually doesn't work.
Tonight we're talking about how Hawaii's veterans can access their benefits and services. Please call, email, or tweet your questions and comments. Call 973-1000 if you live on Oahu, and 800-238-4847 if you're calling from a neighbor island. Here's a question: isn't there a way to set veterans up with health care and other services before they're discharged? Why do they need to figure it out on their own? Is that an experience that you had when you came out?
Yes.
Obviously, yeah.
Yes.
And do you think it would be better to start this process earlier before people are leaving the military?
Yes, but the veteran, I was in the Marine Corps, so in the old days, it's no pain, no gain. So you're hurt, Marines don't complain, they just do their duty. So we have to make sure that before they discharge, that those injuries or wounds are identified before. And they are. For those that are injured in service, they are. But the transition assistance program, it needs to be a seamless transition.
Right.
All right.
And one member of Congress today, who was also at the National VA headquarters when I spoke to them, they believe, as I do, that the relationship with the VA should begin in the moment that you're sworn into the military, because some of the benefits kicked in at that very moment. But then, you go on, you do 4, 3, 6, 20 years, and now everybody that's leaving, they go through indoctrination programs when they leave the military. They are advised to get a copy of their medical records and to establish their relationship with the VA before they actually leave the military service. This is new.
And I know VA has staff that actually
They do
just
this
that.
now, and they didn't.
Here's a question from Jim in Puna. Wants to know where he can get advice as he is potentially homeless soon. What is the first point of contact?
Have him call my office. I'd be happy to work with him.
And that would be Veterans Affairs?
Veterans Affairs, 808-433-0357.
And go straight. And would he also be reaching out to your
And it
organization?
says potential to be homeless. That's the program that we have. You don't want anyone to have to fall and decentivize people from getting help and wait till I have to get worse. That's what I'm hearing from these other situations too. Do I have to be homeless to get care, or do I have to do this? So we would rather work with this gentleman who's in his home right now and help solve those needs so he does not become homeless. Right. And that way, that would be a preventive measure, and it works way better than having them come out and have to become homeless and then go through our program. Our job, no matter what we say sitting here with Andy and myself, is to work ourselves out of a job. That is our job, and we want to continue to work towards that mission.
That might relate to this question from Mike in Kailua. Without naming names, can Mr. Vincent tell us a success story?
Oh, sure. We've had a success story. We have many of them. The biggest one I would tell you is somebody who's been a veteran, suffered from PTSD, was a combat veteran, came in homeless for years, chronically homeless. And we can say without a doubt, it was our first veteran that went from homelessness to home ownership. And that's something that's great. We usually try to get into rentals and affordable, but he was able to get his service-connected pension. He was also working. We linked him up with the people they need to do with the bank and so on and so forth, became a homeowner. And this is after going through a substance abuse program, getting his mental health taken care of. He went back to work part-time, but he was service-connected, so he wasn't working totally full-time. And then he ended up owning his own home. And we have a lot of those stories, maybe not home ownership, but somebody who came in with severe mental health or chronic conditions, and then they come in and the camaraderie in our program of veterans working with veterans, and then getting the access with the VA, and getting the access from other veteran organizations and advocates that we are benefiting from their advocacy. And that's a beautiful thing when they can see that happen. So we have a lot of those kind of stories.
And if I may, in a year, the VA has gone from 600,000 pending claims now to about 98,000 claims. So now we're pushing all of these people from the VBA into the VHA. So there was such a rush to get this done with the scandal that had occurred on the mainland in Phoenix and so forth. So that's where we're going to be suffering, is in the healthcare side. So they need to make sure that they're pushing all these people through. Now we need to make sure we have enough staff on the other side, on the VHA side. Do we have that staff to treat these 500,000+ veterans that have been adjudicated.
So they don't fall through the cracks. We have a bunch of questions coming in on the health side. I've had lots of problems using Choice First. There's a lot of runaround to get the authorization to see a doctor, and then it takes a long time to get an appointment. I call it Choice First, treatment last. Neil from Nu'uanu asks, what is the possibility of the VA switching their ATMO to Medicare or Kaiser or HMSA? Would you like to see that kind of privatization?
Jeff Miller, he's a representative from Congress. He is the chairman for the Veterans Affairs Committee. He and Mr. McDonald, Robert McDonald, were at the DAV convention in August. And I'd like to read this statement. Mr. Miller stated that at the DAV convention, he stated that outside doctors and hospitals could provide even more health care for these veterans and be the solution to the overcrowding at the health clinics. Yes, if they would be willing to take the payment.
Then does everyone agree with that?
Yes.
And I think that our healthcare industry would accept that. They're already accepting Medicare patients, and Medicare has established the precedence to do that. Veterans are just as much human beings as their wives and their mothers and their sisters and their brothers. And everybody seems to be getting pretty good health care. My doctor would accept, my private sector doctor would accept VA payment if I showed him the card, if I was authorized to do that. He would definitely charge the VA for services if he were allowed to do that.
And there needs to be an awareness of oversight. When we throw billions and billions of dollars at this problem, there's going to be corruption. So in Colorado, I was mentioning earlier, the Aurora facility is $1 billion over budget. It was supposed to be a $300 million facility, so now it's $1.7 billion, and they're still counting. It's going ka-ching, ka-ching. They're still racking up the bills. And Mr. McDonald said that if there's any evidence of wrongdoing, he'll prosecute them. So we have to have oversight over the money that's going out.
That would be the VA's job. That and enrolling people, determining if they're eligible for this card. Then you don't need the choice card because every veteran in the nation would be enrolled. That card would be proof of insurance.
And if you have a DD-214,
you can get this card.
get that card.
And make it that simple.
And if you'll notice under my name, there's a little magic word there. It's called Service Connected.
And go with that.
Can I also mention that there's a national call center for homeless veterans, and that number is 1-877-424-3838.
And we'll repeat again the Veterans Administration number, which is 808-433-0357. Stanley from Kahului, Maui says, physicians come to our VA clinic on a 6-month contract. They get here and quickly leave. Maybe they discover they can't afford it. Anyway, it's hard to keep them. Ray from Lapahoihoi says, I submitted a VA claim and received a turn down. It said I didn't meet the criteria, but didn't say what that criteria was. The VA says that they have a duty to assist. How am I supposed to file an appeal when I don't know what the turn down criteria was? Any advice for Ray?
There are attorneys that specialize in when a claim has been denied, they come on board and the VA pays for their services, and the only agreement that the denied veteran has to make is if there's any accumulated benefits, the attorney shares in that payment for any discovered to be accumulated benefits. But the attorneys are there because it becomes a legal matter, and the veteran doesn't have the expertise normally.
And the criteria for a claim, they just had, in July, they came out with the Government Accounting Office, did a big investigation on the claims process. You can have a claims processor in Hawaii reviewing a case, and then you can have a claims processor in New York looking at the same case, but they both come up with a different decision.
So then what happens?
Appeal.
And it goes on forever, and
But are we reading out of the same Code of Federal Regulation? So that's a matter of training. Are these processors being trained in the same way to with their perception of a claim? Or how are they being trained?
Let's focus on a success story for a second. Connecticut today was declared to have ended chronic homelessness among veterans, the first state to do so. Very hopeful sign. Do you think that this is within the future, not just for Hawaii, but for many states? Is this an attainable goal?
Absolutely. We have to, we're in this business to do that. We have to make sure that chronic homelessness is a problem. It's not saying that you end homelessness entirely. We think we make sure we're realistic with people when we say that. We're saying that when people fall into homelessness, we can identify them immediately and get them out of homelessness as quick as possible. So in Connecticut, they ended chronic homeless. These are the ones that have been on the street the longest. The next step will be homeless veterans, period. And then using that model, homelessness for everyone. Does it mean you'll ever walk down the street and not see someone? No, that does not mean that. What it means, when you see them, they're already connected. We know the name, we know what they need. They're going through a system to get them right back into housing so they don't end up staying there forever.
And apparently, Connecticut's standard is that the new homeless vets would be within permanent housing in 60 days. That's the deadline. There's
Absolutely.
a deadline.
Everybody's using the magic word is functional zero, which basically is saying that your average placement rate to permanent housing for that month is greater than the number of homeless veterans living in the street.
We can do this here, but we have to work as a team, and to use a phrase that we've used often in our continuum, we have to be in the canoe together and row in the same direction. Our challenge is going to be with affordable housing, and I'd like to use this as an opportunity to reach out to any landlords that are there, property managers, to help us, because we need their help to house veterans.
Are landlords hesitant to house veterans? Is there resistance?
I think they are. I think there's some stereotypes about homeless veterans, about homeless people, and we need to somehow reframe that. And when I go places and I have the opportunity to speak, I remind people that these are people that wore the uniform of our country at one time. These are people with names. These are people with families and names, and they need our help.
A question came in, has there been any consideration of the empty barracks at Barbers Point being used to help homeless veterans? Is that in discussion?
We're located at Barbers Point in a renovation. I won't say the problem, but the obstacles with those things is there's a lot of regulations to go into what is considered suitable for people to live in. You would say, well, it's empty, let's just put people in there. But the reality is, if you want to get the proper funding, the proper things that you need to do, there's a lot of regulations that go in doing that. I think what I will say to that comment is we have to start being innovative and creative and figuring out ways that we can use the property and lands we have, and who wants to help, as Andy's pointing out, with property management and the privatization of people that do development. What can we do? Because it's not going to take just the government and advocacy and nonprofits in the VA. It is a community problem, and that's from the president down to the individual homeless. The homeless person has a responsibility just as much as the president does, and it takes all of us to do this together to figure those answers out.
Enter the state legislature. One state senator has told me personally that he is planning to advocate that all government housing in the amount of housing that we have here should be declared transitional. And it's not. We have people camped out in Section 8 housing for generations, and sometimes they sublet it.
Would that help the issue?
If we freed it all up, there'd probably be there wouldn't ever be a glut on affordable housing, but what they pay people who are on state assistance or feeding at the public trough, they pay 10% of the rent, because what they're making is 10% of a living wage here in Hawaii. So you take 1/3 of that, and it $128 becomes their rent on a $1,200 studio apartment somewhere in Honolulu, because it's assigned to Section 8.
Mr. Vincent, I'm sorry.
We need to be out of the box in our thinking.
Yes.
On our homeless task force, retired General Mossman is actually looking at, in charge of the housing committee. So we're hoping that she makes some headway.
Do you believe that that is an issue in terms of...
The issue is we need more housing, and that's what everyone's saying.
Yeah.
You know, whether it's considered permanent transitional, where you're doing that, we want more affordable housing. And to answer your question, to go back before, it's not only the stigma of renting to homeless veterans. When you have an affordable unit that pops up, you don't even have homeless people competing. You have people that are not homeless, that are living on the fringe of that. And so you're competing
Too much demand.
Different tenants to try to get into this housing. So hopefully landlords, because we have such a great military culture out here, will say, yes, we want to take a chance on a veteran and the situation they're in with the agency they're working with.
And we had a landlord summit last month when Secretary McDonald from the VA was here, and it was hosted by the mayor. That was successful. There's going to be another landlord summit in November. So we're trying to get the message out, and we need the community to help us, and we need their support.
All right. From Dennis in Honolulu, he thinks the VA should hire local doctors to work using the existing VA clinic at night and Saturday when it is not being used. Is anything out of the box like that being considered on healthcare? Any thoughts on that? Is that even a possibility?
I know that they do work on Saturdays, and I know they're there till 5 o'clock at night, I believe, in the mental health building that I'm in. So it's something I think they should mention to the director.
Would something like that help?
The outer islands are unique. They're lacking. I was just speaking with a doctor on Wednesday. They need more people. There's an application process right now. It's open for other physicians to apply right now. So they're reviewing. The people that are hiring are looking into these applicants. The good thing with Hilo, they just approved and signed for a giant building on Kawili Street. It was a former commercial property. It was never filled, and it's going to be the new CBOC for Hilo. It's a really large building. So,
And that will help.
yeah, so it's going to be mental health and social workers. It's going to have medical. So it would be great. One caller was asking about getting private doctors in there if they can volunteer their time. They're going to get paid. It just takes a little bit longer for them to get paid. They don't have to volunteer.
From Don in Kunia, he thinks Honolulu needs a dedicated VA hospital. Tripler is not open to most vets. The Matsunaga Clinic is only 7:30 to 4 for 5 days a week, and problems happen 24/7. Is that a need that you think is out there? Do we need more physical space on Oahu?
We definitely need to, again, I think it goes back to the original question of the VA partnering with other ones if that's not the need. That's usually I'm assuming, Randy, that's usually where they draw the line on the road. Does the VA provide the care? If they don't, they contract out for it. If they provide it, they will do it in-house. Can the VA provide the care quality and capacity-wise? If they can't, contract out. So if I was having a problem at my nonprofit that the VA may or may not be having about the care and access, you have to examine it, figure out what capacity is, and figure out what you contract and what you don't. The problem we have, obviously, is that it's not at the local level. It's bureaucratic, it's federal. Making those changes just don't happen overnight. And I think we all agree with that it's not just the worker, it's the bureaucracy sometimes, and we have to learn how to navigate that.
And I know that the VA is rolling out additional clinics in Eva and in Windward. I know that's
So there is more space being added.
I think there's been great transparency about that.
We're down to our final minutes. Let me go around the table quickly and ask you, if you could have one thing change in the next year, 18 months, what would it be? Mr. Eggy.
Outsource healthcare delivery to the healthcare industry.
Mr. Vincent.
Veteran homelessness will be ended. Every veteran will have a home. It's definitely person take away their dignity to live on the streets when they defended those same streets. It's unacceptable.
What is your dream deadline for that here in Hawaii?
2015. That's our deadline we're working towards right now.
Okay.
We're trying to work ourselves out of a job in about 5 months.
That's correct.
That's a quick deadline.
We both share that. End homelessness. We can end homelessness and not just maintain it.
You think it's possible in 4 to 5 months to reach that goal?
Functional zero, yes.
Yes.
It just takes a unified effort, yes. But it's going to take a lot of work. We're not trying to pretend that it's not a hard situation to do it, but we have a lot of good people working on this.
This is what gets us up every morning. This is what we're focused on.
Mr. Fratinardo?
Incentivize the process so private physicians they're motivated to get involved.
By providing further funding for it.
Correct. You'll get more veterans treated. You'll just have it's about quality of life for these veterans. And streamline the process. If you're a veteran with a DD-214,
which is?
That's your separation papers from the military, regardless of whether you were injured or not. If you served, you can take that paperwork down to your local VA CBOC, community-based outpatient clinic, and be treated.
With no questions asked, and you're given a card and you're on your way.
Correct.
All right, thank you, gentlemen. This is a very interesting conversation, and it sounds like the next time we talk about this, hopefully we'll be in an even better place.
Yes.
All right, thank you.
Thank you.
Next week, Insights will be on hiatus. When we return on September 10th, a survey conducted earlier this month shows that Kaka'ako's homeless population has grown to nearly 300, a number that includes 31 families. The problem isn't just in Kaka'ako. Across the state, more children are growing up unsheltered, spurring renewed efforts to find transitional housing for homeless families. How are homeless parents managing to find work, get their children to school or daycare, and to keep their kids healthy? On the next Insights, what unique challenges are facing parents who are raising children in homeless environments? That's next time on Insights on PBS Hawaii. I'm Malia Maddock. A hui hou.